Coming. My name is Dr. Shelub. I'm one of the infectious disease doctors at the local hospital. Some of you may know me. Today I was going to talk about hand washing, its importance. It seems like it's a very obvious subject, but believe it or not, this is actually one of the major causes of healthcare-associated infections. Most common transmission of pathogens is via the hands. So our hands are deadly. You're probably aware of this. Alcohol actually is the most efficient and effective way to wash your hands. So if you take nothing else away from this lecture, alcohol rubbed on your hands is the most effective way to cleanse them, let them dry, and you'll be able to present clean, safe hands. Clean, safe hands to your patients. So one of my favorite professors told me that tell them what you're going to tell them, tell it to them, and then remind them of what I told you. So that's what I'm planning on doing. So, infection is part of healthcare. It's a major cause. Spread of antimicrobial resistance. So, one person or patient, in your instance, has VRE. If you walk into the next room and touch that patient without cleansing your hands, you can easily colonize or even infect the next patient. Can everybody hear me?
Yes.
Consistent? Okay. I'm used to speaking behind a podium, so this is a little bit unusual for me. But if you have any questions along the way, feel free to ask me or interrupt me. This is very informal. I'll try to keep the lecture about 30 to 35 minutes. Beyond that, I think most people aren't going to pay attention. I know this is kind of a tougher hour. You can get a little bit tired around 3 or 4 o'clock, just naturally. So, the impact of healthcare-associated infections, just to give you a general idea of why am I talking about this, why is this important. It can cause more serious illness, prolongation of stay in a healthcare facility, long-term disability. Just want to note, if you could just not stand in front of that camera, because I'm going to try to videotape myself. Thank you. Feel free to sit anywhere. It's very informative. Excess deaths related to poor healthcare practices, not washing your hands. And there's a high additional financial burden. So, why do people not wash their hands? Why don't we start off with that? Is there anybody who feels like that washing my hands is just a waste of time? Right? That's a loaded question. Anybody who fine? Right. Okay. Hand washing causes irritation and dryness on my hands. Right? That's one of the concerns. Sinks, it's just inconvenient. Lack of soap or paper towels. Too busy, insufficient time. I just don't have enough room to move around. It's overcrowded. I'm just busy with patients. These are the most common reasons, and then I'll try to dispel each and every one of them so you have an idea of there's really no excuse for not washing your hands. It's a very simple act. It really takes 20 seconds to wash your hands with alcohol if you go between patients. And it's really the best way to do it. That's the other part of it. So, most frequent sites of infection and the risk factors, right? You probably know this. Does anybody know these four? What are the most common healthcare-associated infections, right? Urinary tract infection, surgical site infection, pneumonia, lower respiratory tract infections, which we refer to here, as well as surgical site infections and blood infections. So, bloodstream infections from peripheral IVs, meaning that phlebitis gets infected and can come back and remit, or it could be from a central venous line, which is the most common. Okay? All of this is actually related directly to lack of hand hygiene. So, there are validated and standardized prevention strategies that we can do to prevent healthcare-associated infections. So, has anybody heard about bundling things to keep a central line of insertion clean? Right? That's actually a more complicated way to prevent healthcare-associated infections. Another way is endotracheal tubes that are lined with silver is another way. Keeping the bed up 30 degrees so people don't aspirate. These are all interventions you can do to prevent healthcare-associated infections. But believe it or not, those are more expensive and probably less effective. One of the most effective ways is just washing your hands. Okay. So where did this idea of washing your hands come from? It wasn't something that we were born with. In fact, up until the 1840s, as you can see in this slide, people did not know about it. Has anybody heard about puerperal fever? This is something that women may be interested in. In the 19th century, up until around the middle of the 19th century, women had incredibly high rates of child care, or childbirth associated death, right? So one of the reasons was nobody had figured this out. Whoever was performing the actual birthing process, taking their hands and helping birth the child, frequently was with hands that were actually unsanitary, unhygienic. So what Semmelweis discovered, he was a doctor in the 1840s in Vienna, was that if he had doctors who were going from the morgue, looking at cadavers, studying medicine, going directly into the midwife clinic, or directly into the clinic where women were birthing, compared them to midwives who were not examining cadavers, the rate of puerperal fever, this horrible associated fever with childbirth infection of the canals, was much less than midwives, right? So you think, well, that's interesting. Why is that? Because midwives aren't technically doctors. Doctors are supposed to be better. Well, the reason was doctors were going straight from the point where they were examining the cadaver and directly birthing the females, meaning their hands were full. So what did he do? He said basically, scrub your hands with chlorine, then birth the child. And what happened was there was a dramatic decrease. I wish I had a pointer, but we just don't have one. You can see here there was a dramatic decrease in the actual maternal mortality associated with this intervention, washing your hands. So all of a sudden, the maternal mortality associated with birthing was much, much higher compared to midwives. It dropped right back down to the same level. So this was the first historical precedent that washing your hands actually is an effective way to prevent infection. Up until that time period, people didn't know that. There was a long time coming before people even understood what germ theory was. For a long time, people didn't understand what caused infections, right? It's not something that you're born with. It's not an idea. And we take it for granted that germs cause infections. Being unhygienic causes infections. For a long time, people thought infections were spread by bad humors. In ancient times, people thought they had bile or biliary diseases or bad blood and would actually bleed people. Right? That's actually one of the worst things you can do for somebody with an infection. Does anybody bleed people? Probably not. That's gone by the way. So if you are, I think you should probably stop. But the other thing was that people thought that infections were spread through the air, miasma. Now there's some truth to that, right? Because some infections are spread through the air. Tuberculosis, influenza, droplet precautions, all these things have meanings, but we didn't really understand germ theory. We didn't understand why people actually got sick until one of these initial studies. Right? It turns out that Semmelweis eventually went insane because people did not believe him. That's one of the reasons. But sad story. That's a difference. That's a historical aspect. Okay. So what's the difference between being colonized and infected? Does anybody know? Exactly, right. So somebody who's colonized basically means that they have the bacteria on their skin, they have it probably in other regions of the body, they probably have it mostly in their axilla, perineal region, also I guess in the inguinal region as well, probably in some of the deeper layers of their skin, if you think about it, in the subungual regions. So they're not infected. They don't have fevers, like you said. They don't have a high white count. They're not actively infected, so they're colonized. Basically, if you swab my skin right now, I just washed it with alcohol, you probably wouldn't find anything. But if I hadn't washed it with alcohol, you probably would find something very common, like coagulated staph, diphtheroids, as well as anything that I may have touched previously that could have bacteria, right? So if somebody put this in a room with MRSA or VRE, even on an inanimate object, or a patient who was colonized with that, and then I picked it up and touched it, and my hand, do you think it has any bacteria on it? Could it have one of those potential bacteria on it? Yes, it could, right? But that doesn't mean I'm infected. It doesn't mean that Dr. Shelub has an MRSA or a VRE infection. It just means that I'm colonized. Just one note, I'm videotaping myself, so if you cannot stand right from that one. Oh. Yeah, no, that's fine. I'm really self-conscious about that. Okay. So the iceberg effect is basically the idea that what you see is actually only part of what's going on beneath, right? So everybody knows the story of Titanic. When you're approaching a big iceberg, it looks very small, perhaps, from the outside, but deep underneath, there's a lot more. So that means what you see on the patients as just basically a few organisms here and there, there's much more going on. There's likelihood that they have multiple different bacteria all over the skin. So the point is, even patients who are not infected or sick have bacteria. Is this too basic, or do you think this is right about the right level? Okay. I'll try to go faster, since this is more interesting. Okay, so I touched on this. VRE is basically one of the MDR organisms, multi-drug resistant organisms we deal with a lot in environments like this, also in the hospital, any long-term care facility for that matter, or any hospital. So basically, 41% of healthcare workers' hands were sampled after they touched the patient with VRE, or they went to a room where the patient was known to have VRE. 41% of them were positive after they swabbed their hands for VRE. So it happens. It's a high rate. These are all the potential places, right? So you walk into a room, you're not going to be in a critical care unit here, but you just touch this, you touch that, touch this, touch that, and you walk out of the room, and then you go to the next room because you forgot. I have to admit, I'm not perfect. Any doctor who tells me I never forget to wash my hands is basically a liar. I've caught myself multiple times as recently as last week. I forgot to wash my hands. And it's just, you get busy. So the trick is really actually to do it right when you exit the room. Okay? Otherwise, you just forget. Okay. 5 stages of hand transmission. This is a little bit redundant. So germs are on the patient's skin. You transfer it to your hands. You transfer it to another patient. And then basically, you touch that patient's catheter, right? There's a high percentage of those patients who touch their catheter after they don't wash their hands. That organism will be the cause of that urinary tract infection. Or you touch the central venous line. You guys have central venous lines here? Maybe PICC lines? Yeah. So you walk into the room, you examine the patient, you touch the groin or what have you, and then you walk into the next room, and then you start to adjust that central line. I mean, it's incredible. You know, as far as healthcare is advanced, all the modern things you can do, it's as simple as that. Just avoid that. Actually, that's probably the take-home point of the lecture, just what I said right there. You probably have some chips, have soda, relax now. Okay. All right. So I put some questions in so that would be more interesting. What do you guys think is the answer to this one? Anybody want to raise their hand? What's the most important reason? What is the single most important reason for healthcare workers to practice good hand hygiene? Right? Okay. You guys are a little bit shy. It's probably all of them are reasonable, but the best answer is number 4. Prevent infections, right? You gotta wait for that. Okay. So what are the ways you can wash your hands? You can use soap or water, or you can use alcohol rubs. Okay. I probably already said this, but what's the most effective way to wash your hands? Alcohol rub, right? Yeah. Alcohol rub, and I'll tell you why. The reason is, I'll show it on the next slide, is because the amount of bacteria on your hands is going to be drastically reduced for a prolonged period of time if you use alcohol rubs. Okay? When you wash your hands with soap or water, there's a limited amount of time that you actually will the bacteria be off your hands. They don't have the same type of antimicrobial effect. Now, washing your hands with antimicrobial soap is better than regular soap and water, but alcohol-based soaps are the best. Okay? So I'll go through some of those things in more detail on the next few slides. So how often should you wash your hands between patient contact? Never. Of course, here's your policy. I'm just sorry here. I just thought I'd just tell you a bunch of stuff, baloney. Right? These are very simple questions. Always. So this is what I alluded to earlier, right? So I put my hand on this table, and then I put it on an agar dish, and then you incubate it. This is what you probably find. It's incredible. We're just, unfortunately, this is just the status that we're in. Our bodies are covered with bacteria, normally. Okay? All environments have bacteria. You just can't avoid it. It's just part of the world. So the only thing you can do to prevent infections is basically to eradicate that before you touch somebody sick. Okay. This is interesting. I added these slides because I thought these were sort of fun because you think that everybody knows how to wash their hands, but there's more technique to it than you may realize, and there's some interesting things that I've learned myself. So basically, hand rubs, you apply to your palm, you rub your hands together, and you make sure that all surfaces are dry. That's a trick, actually, that I probably didn't realize until my fellowship, which I actually did training just down the street here in Plummer at the VA, is that you want to make sure the hands stay dry. Right? That's another trick. Is that you hit the alcohol rub, walk into the next room, this happens to me all the time because I'm busy, and your hands are all wet. Now, when your hands are all wet like that, do you think that you've actually eradicated the bacteria? Right? Obviously, the answer is going to be no. Psychologically, you figure out that I'm telling you the answer is no. And the reason is because the drying effect is actually the major portion of the killing of bacteria. So technically, what you want to do is, and I'll show this in the next couple slides, is rub your palms. They say you go like this and like that, and you rub like this. I mean, that's a little excessive. Basically, make sure you cover all parts of your hands. Here's another trick. Is go like this. Put your fingernails together. Like this. Right? This is called the subungual spaces. And I'll use this in more next couple slides. Bacteria love these spaces underneath your nails. And women, I'll talk about this in a few minutes. My wife is a manicurist, but she doesn't like it. Artificial nails, major place where they like to hang out. Okay? So hand washing is basically the same concept. You take your hands, you wet them with water, you put soap on it, you rub it together for 15 seconds. Some people say happy birthday 3 times. And then you rinse it. The trick here is that when you rinse it, well, let me just show you the slide. When you rinse it with hand washing, I'll show you the next slide. You want to take the paper towel off, close the sink with a paper towel, throw it away. Don't touch the sink, your hands are clean. So this is what I talked about. This is how you do a hand rub. I mean, this is what the WHO recommends. So basically, the only things that I thought were different is that once you do the rubbing, they say go like this, go like that, this, that. It takes 20 seconds, actually. I personally just rub it. I do like this, and that, and then this. Okay, that's probably just as good. As long as you do some activity that covers all portions of the hand and the subungual spaces, you're going to find that your hands are going to be much cleaner. You probably will see that your healthcare associated infection rates will go much further down. And just as an interesting aside, there was a recent study in CID about how to evaluate people's compliance with healthcare stuff with hand washing. And one of the things they found is that having video cameras up in each and every part of the ward really helped compliance. Not because people have to be spied on, but because people need to be reminded. It's just hard to keep it in your mind at all times. So I talked about how to wash your hands with soap and water, probably less effective. But this is basically the last point I wanted to make, is that don't wash your hands. Take a paper towel, throw the paper towel away and close the sink. Take the paper towel and close the sink and wash your hands. Here's another thing that comes up is that, okay, what do you do if the patient is a C. diff patient? Right? Do you use alcohol or do you use soap and water? Yeah, it's soap and water. And the trick here is that what I do, and it's a little bit more nuanced, is that when you go in the room, you see the patient, you wash your hands with soap and water. I try to take the paper towel out of in the patient's room. I dry my hands. I'm sorry, no. I actually wash my hands in the patient's room, and I try to close the sink with my elbow. And then I try to actually dry my hands outside the room, because technically the paper towels may actually have to support them. Okay, that's a little bit more nuanced. It's not totally proven, but I think that's probably actually a good technique. Am I clear? Am I going too fast? You guys feel like this is right about the right speed? Okay. If you have any questions along the way, this is very informal. Yes?
Yeah, but we close when you turn off the power,
Right.
your elbow.
That's right. As soon as I say that, I realize the same thing. Right. It's not perfect. There's really no perfect way to get a patient to see it, because basically we do take the paper towel out of the patient's room. That C. diff score may be within the rule, it may not. Okay? But yeah, it's a good point. Estimate how often you clean your hands after touching a patient or trips in the hospital. What do you guys answer here? 25%? It should be 100%, right? Always wash your hands. How often your coworkers, right? You can write this down on a slip and hand it to so-and-so.
Somebody not washing their hands. Better tell Sally.
Okay. Adequate hand washing with soap and water takes about 40 to 60 seconds. So that's the problem with washing with soap and water. It takes longer. Okay. It's interesting, some of the previous slides from Deborah chose say 15 seconds. It's probably more like 30 seconds. But with alcohol, it's really actually about 20 seconds with a hand rub. So that's really the best. Okay, this is sort of interesting. I went to a talk in November. It was November or December. It's called the Infectious Disease Association of California. Dr. Weinstein is one of the major guys in healthcare epidemiology. Right? He's one of the editors for CID. And he put a slide out I thought was hilarious. Basically, the hand hygiene, even among healthcare workers, is really not that good, even doctors, for instance. Right? So about 51% of the healthcare workers said they actually wash their hands, which I thought was pretty abysmal. And this is 1999. And then they said, okay, well, let's see, they're not even doing that. Turns out 28% were actually doing it. So this is just a standard healthcare facility. So it's really a common practice that people just forget or don't do it. I don't know, do you guys have a rate that you calculated here? That you found?
So what we do is we track the nosocomial
Right. Yeah, you might be interested at some point to create a project where you actually track or have somebody watch to see how people are doing with hand washing, for instance. One of the things you can do is have somebody who's pretending to work maybe paperwork and just kind of watch, or you can put like video cameras. You know, if you saw somebody like me, you know, Dr. Shelub, infectious disease, walking around the hallway, you probably go, oh, everybody's washing their hands. Right, that's the other thing that's wrong with these gloves. Yes, we should get to that next. Okay, but you know, it just goes to show that there's a real problem with this. Here's another one. And so then, oh, Dr. Shelub, you're so righteous. You do everything, you know, wash your hands all the time. So even doctors who are like me, infectious disease experts, were asked when they went to a recent meeting. This was actually a while ago, but I thought it was still funny. You can probably find the same thing. 67% of the doctors wash their hands. Infectious disease doctors after going to the bathroom. Right? Can you believe that? So this goes to show how hard it is to get people to consistently wash their hands. Now, women can probably feel better. You guys already know you're superior, but 87%. Men, we're dirty. Guys look tough. This doesn't have to be so serious. Make this interesting. Okay. My 5 moments of hygiene is another slide I added recently. I thought it was very interesting. So these are the places you really got to remember to wash your hands. Another thing that I saw a great lecture yesterday about doctor-patient communication, but I thought it was actually noteworthy for all people who are doing healthcare, is that as soon as you walk into a room, this is what an ethicist was telling doctors how to deal with patients, is that you don't have to touch something, but you can just like do a signal to yourself. Okay, I'm going to be conducting patient care. I'm going to wash my hands. It's like you go into a mental focus. So that's a technique that I was actually thinking of incorporating in my practice. Every time you walk into a room, just go into a different mindset, wash your hands, and you're a professional. When you walk out, you can deal with any other issues. Because otherwise what happens is you walk in and out of rooms so quickly, you kind of lose your focus, you're thinking about what happened in the other room and this room. Right? So before you touch a patient, before you do a procedure, obviously, after any body fluid exposure, after touching the patient's surroundings, so pretty much any situation. This is my 5 moments of hygiene. Okay. So which method do you use to clean your hands at work? It should really probably be alcohol-based. Does anybody, I mean, I don't know if you guys want to say that a lot, does anybody find that they just can't tolerate alcohol-based hand rubs?
Sally, weren't they going to change those rim things to alcohol? I heard something about that.
Yeah. Do you guys have alcohol-based hand rubs?
Yes.
Yeah, it's probably a
They're not alcohol, are they?
Oh, yeah, they're probably like 60%.
Are they all
60 to 90%.
Yeah.
Most
Most places are like 62% alcohol. That's fine. Yeah.
Well, we have them in every room.
Every room.
And I...
Well, basically, I was going to say that you want to make sure you have them in every room that's easy to get to, and that some people, don't like using alcohol-based hand rubs because they feel like it smells bad.
Oh, that was it. We haven't had anybody...
Is anybody, okay, because some people, you may want to tell you confidence later because that could be a real impediment to compliance. You want to make sure that everybody in the facility feels very comfortable with the particular brand that you have. because if people don't like it, smells offensive, when they find that it actually makes them nauseated, that they won't use it. And that's actually a major issue, believe it or not. You probably save thousands of dollars just by using a healthcare product that people actually buy. So, some facilities, I find that, are better than others. For instance, at Valley Crest, they have a good, it's like a 62% ethanol solution, but what they do is they add emollients in different types of things to actually keep your hands nice and, it's a little, not humidified, but soft. Moisturous, yes. So, you want to be aware of that. It's something we will look into. If everybody's pleased with it, then good. But the other thing is that people may, I'll touch on this on future slides, may feel like, oh, if I use alcohol all the time, it's going to dry my hands out. And the answer to that is actually no. It's actually going to be keeping your hands much more moisturized because it has all these emollients. Drying your hands with a paper towel and washing them with hard water and soap is probably going to cause more hand damage and more problems with dry skin fracture. Okay, so I'm kind of skipping around because I think the slides, just following verbatim is a little bit boring. But again, if you have questions along the way, make it more interesting. So, plain soap is what we used to have. That's probably okay. It's not going to be as effective as antimicrobial soap or 4% chlorhexidine. And again, I've said this like 900 times. Alcohol-based hand rub is the best. Okay. So, I touched on this earlier. Why is alcohol-based hand rub better? Well, if you wash your hands with plain soap and water, within a short time span, approximately around 60 minutes, your hands will quickly be recolonized. Whereas, if you're actually going to wash with alcohol-based hand rub, for instance, they're referring to 70% isopropanol. That's not what most hospitals use. It's usually 62% ethanol, which is probably not just effective. The amount of time that you're going to have decreased bacterial burden is going to be much greater. Does that slide make sense? So basically, 180 minutes out after washing with an alcohol-based hand rub, I would not touch anything, just walk around like this for hours. My hand would still be with almost only 1% bacteria, whereas with plain soap, they quickly, within 60 minutes, that bacteria all back over. Because they have a persistent antimicrobial effect. Alcohol kills. Okay, I touched on this earlier, you probably know the answer. Which of the following hand hygiene agents is least trying to your skin? It turns out it's actually alcohol-based hand rub, simply for the reasons I stated. It has emollients. Okay, is it acceptable for healthcare workers to supply their own lotions? What do you guys think? To use in your hands. Actually, you probably don't want to use. This is actually very, very common. I see this all the time in the ICU business. I don't usually say anything, but I should probably say something from the infection control officer. You really don't want to bring your own lotions. And the reason is for your own health and also for the patients. Because what happens is some of these interact with the particular alcohol-based hand rubs you have. It may deactivate a certain amount. Plus, these little bottles of lotion can be quickly colonized. They in themselves don't have any antimicrobial property, right? So if I were to bring in a bottle of lotion, work every day, I put it on the counter, touch the counter, maybe I washed my hands or I didn't, and then I touched it. It's on this. You get in the lotion, so then every time you're washing your hands, when you're putting the lotion on, you kind of just basically nullify it. So if you need lotions, you really should. You guys have lotions? Some people really like this. I don't use them. I feel like that the alcohol-based hand rubs have enough moisturizer. But some people like it. Okay, some people don't want to just wash their hands with alcohol. They want to moisturizer on that. They want to use a very specific one, only that your facility has. Okay? And the reason is for what I stated before. Don't bring your own bottles of lotion, because think about it this way. You're bringing whatever you had here back home with. You use it at home or just work alone. Okay? Alright. The other thing is that some lotions actually cause breakdown of latex gloves. Which is interesting. I didn't know that myself, but I read this recently. You can actually decrease the permeability, or increase the permeability of the latex glove by destroying some of this property. So that's the other point. I think I'm going to get to this in a couple slides, but just in case I forget. Best thing you do for a patient here is walk in the room, hit the thing. I do it twice. Do the hand washing, suboptimal spaces, put the gloves on, right? Then examine the patient. Sometimes you don't have enough time, right? So you have to do the alcohol rub, do it, dry, go in there. What I try to do is I walk in the room and I start talking to the patient, interacting. I say, just excuse me a second, I'm washing my hands. The patients like it because they see I'm washing my hands. It makes them feel more comfortable at the same time. It draws their attention to it. Some patients are becoming more aware of this. There's a lot of advertising out there saying, make sure your doctor washes his hands. So it can reflect badly on the facility or your practice if they see that you're not washing your hands. It makes it less common. So I walk in, I hit the dispenser, I wash my hands with a hand rub, and at the same time I talk to them, I put the gloves on, and then while I'm getting ready, I'm sort of interviewing them and then examining the patient. So you really want to be using the gloves. And then take the gloves off, throw them away, don't bring it into the next room with you, and then you want to repeat the same thing. Now when I exit the room, I take a little bit of alcohol. Does anybody know how much of the alcohol-based rub you want to use? How many squirts? Okay, you're probably get around 1 cc, I think, in most of these machines. I think that, 2 squirts, which is almost like 2.5, 3, is probably a little bit better. So I find that if you don't get enough alcohol, you really probably can't cover your entire hands. You probably won't be able to do as good a job. So make sure, I just hit it twice, and I wash it really good with the angle. Okay. There's a lot of nuances to this, right? It's interesting. You think that just washing your hands would be like a 1-minute lecture. But a lot of these points are based on a guideline called HICPAT, which is basically a meeting of infectious disease specialists, infectious disease doctors. In 2002, we created guidelines. There are guidelines. Infectious disease. Who was the infectious disease specialist here? Or infection control specialist? Right, so you probably know about some of this stuff, right? How much time would an average nurse in the ICU save if she washed her hands with alcohol? He or she washed her hands with alcohol-based rub versus soap water. Not sure that. Yeah, very good. Or good test taking skills. Always pick C. That's a problem. Yeah. Physical therapy, you probably have more experience. So yeah, that's exactly right. So based on 12 opportunities per hour, hand washing time is 60 seconds. Alcohol-based hand rub is about 20 seconds. Okay. Healthcare associated organisms are commonly resistant to alcohol, right? So everything I just said was baloney because they're all resistant. Right? Obviously the answer to that is no. Because alcohol-based hand rubs work. There are no reports of bacteria resistant to alcohol. And I know this because I actually looked up during my fellowship. So I thought, I'm going to have a great conference. We take a conference every Tuesday. I'm going to show some new articles showing that alcohol-based hand rubs are becoming, or organisms becoming resistant to it. And I looked. No, there's no reports like that. Always works. Okay. When a healthcare worker touches a patient who's colonized but not infected, it's okay. It's not going to spread anything, right? No. The answer to this is colonized and bacteria is there for the use of spread for patient. Okay. So I love this. Another slide is like, so you're not going to step in it. So why don't you put your hands in it? Right? So it's blunt, but the point is, there used to be, for a long time in the 1980s and early 90s, some nursing homes, I don't think you guys, I know you guys wouldn't be like this, where they would take rags, wipe patients down, including their bodies, and go to the next room. Right? That's one of the ways that we have these organisms called ESBL, extended spectrum beta-lactamases. You guys ever heard of that? That's how they spread, because basically these patients are on multiple antibiotics, and one resistant organism that spread throughout, and we can never stop it. Now, what's coming up next is we've got something called KPCs, which are carbapenemase-producing, Klebsiella-producing carbapenemase organisms. So we basically kill, pen down all the carbapenems. So we've got to be careful with this. Okay, so believe it or not, the Dutch doctors were definitely on to something in the Middle Ages. This probably did actually prevent some spread of infection. Believe it or not. Because he was gloved up, he was wearing a gown, and he had a mask on. Now that's assuming that he would wear or wash it before he saw the next patient. Okay. A co-worker examines the patient with Gary, he then borrows my pen, without cleaning his or her pen is likely to contaminate my pen with VR. Yeah, front of me, obviously. How often do you clean your hands after touching an environmental surface? Every time. Always. Okay, so I touched on this briefly before. Use of artificial nails by healthcare workers poses no risk to patients. So have you guys addressed this issue? Have you addressed this issue before with some of the staff? Yeah. Does anybody? Yeah, no, you should probably, if you can, avoid artificial nails. Because what happens is any nail that's greater than 1/4 of an inch really is a great place for bacteria to hide out, especially gram negatives, which is a major problem in nursing homes. So rehab facilities. So when your mom said keep your nails short, there's a reason for it.
That's good fighting, you know.
That's probably one of the worst things. Yeah, I know my wife is crazy. And my son also puts his hands right in his mouth. Just makes me nuts.
They all do
He's
that.
2 years old.
They gotta develop a
Right.
little immune
Yeah,
system.
and he is. He's sick every other day. So. Okay. Can a fashion statement harm a patient? Well, I just said that. Yeah, it could. So basically, this was recovery of organisms, gram-negative bacteria in particular, after patients were touched. If they had natural nails or artificial nails, you can tell this is very statistically significant. Artificial nails, 35% would have gram-negative bacteria previously. People with polished nails, natural nails, 35%. Okay. Glove use for all patient contexts is a useful strategy. So, yes, I said that. Basically, if you can, wear gloves on every patient interaction. Don't take those gloves and use it for the next room. Wash your hands. Try to throw the gloves away. Take alcohol again before you leave the room. Okay. I touched on this a little bit briefly, but just to reiterate, so you feel like it's based on factual knowledge, there's a study in infection control in 2000, self-reported skin score, brittleness of skin, dryness, cracking associated with use of soap and water versus alcohol-based rub. And you can tell that alcohol-based rubs are actually causing healthier skin reports after 2 weeks. So basically, baseline and then at 2 weeks, people who are using soap and water predominantly, it's this aqua one on the left-hand side here, had a much higher skin reported score, meaning that they were less healthy. I didn't say that best. Soap and water used to make people complain more of dry skin. Okay? More scientific was epidermal water content was actually better for people who used alcohol-based rubs. So you can actually measure the amount of water content in the epidermis. People who used alcohol-based rubs, because they have moisturizer, is higher. Okay. We're doing pretty good. I think we're having about 5 or 10 more minutes. Just hang with me. You guys still there? Yes. You all right? We're going to get hot. Okay.
Water gets
It's exciting. Take these kind of show, please. Okay. Okay, this is cool for you guys. I think you could come up with a program, monitor healthcare workers' adherence to recommended enhanced hygiene practices, give feedback. There's all sorts of things we can do if you're interested. Encourage patients and their families to remind healthcare workers. Okay, so that's one thing you want to be aware of. Patients' families are probably going to be inundated in the next few years with facility scores, and things to look for in your facilities. So you may have people who are watching your staff see if they're washing their hands. We're encouraging patients to tell doctors, right? Even doctors to wash their hands. Protect your patients, protect healthcare personnel, promote quality healthcare. Now, this is fascinating. This is more just for fun, but if you take a psychological experiment and you take people and you force them to write down a story, for instance, one story is about somebody who woke up early in the morning, saw somebody crossing the street, was elderly, almost getting hit by a car, ran out, risked their own lives, helped them walk across the street. So copy that story down. Versus somebody who copies the story down and says, you found this paper on your desk. Turns out this is your coworker's paper that they're going to use for that presentation tomorrow. They don't have it. They don't get that promotion. Oh, I get it. Unethical, right? You hold on to it. You have to write right down that second story, we're much more prone to actually wash their hands right afterwards. It's actually a psychological phenomenon. So believe it or not, so when you think about it, if you can convince yourself deep down psychologically when you're in a room that what you do is affecting patient care, and not washing your hands is deeply unethical, you probably on a subconscious level will be more effective at washing your hands. And finally, if I can appeal to you that way, the lowest basis way I can appeal to you is maybe later in the day. And hygiene.